The Health Ministry also revealed today that there were 2 to 3 patients that have fully recovered and discharged, but still tested with a weak positive. This is because they were at a virus-shedding state, a state which does not pose a danger to the person themselves and to the people around them. We spoke to University Malaya's Tropical Infectious Disease Research and Education Centre Director, Professor Dr Sazaly Abu Bakar, to explain what this means. Take a look.
When the DG spoke about virus shedding, I wasn't sure whether he was referring to live virus, meaning infectious virus, or it's just a detection of the virus genome. Because it is very common in any virus infection is that once a person fully recovered, but you can still detect the virus genome somewhere in the body. But that doesn't mean that the virus is still alive. For example, you can detect the virus in the urine, you can detect the virus in the stool, but oftentimes most of these viruses, they are already dead. But for these particular cases, I'm not sure whether they have shown that the virus that they were able to detect, whether these viruses are still alive, and meaning whether it's still infectious. We know that, for example, from data from patients in China, that you can actually detect the virus if you do the rectal swab. I mean, you take the stool sample, you can see that some patients will continue to shed the virus for up to 30 days after infection. So, I mean, that would be a long while, almost a month after. Yeah, but there is no data to show whether this virus were actually infectious. The DG was saying something about, the detection limit was very low. That could be possible also, because when the virus is still very low, even the most sensitive method that we are using now, what we call RT-PCR, may not be able to detect. So that doesn't mean that the virus genome is not there. It's just the limit of the detection of the technique that we use. So it is not surprising that, over time, 2 or 3 days after the patient was detected negative, it will be positive. So, but it's not a new infection. It was just that the presence of the virus genome, not necessarily infectious virus.